So hello friends, most welcome on our YouTube channel A Man in White Coat. So today in this video we are going to study or we are going to learn about Helminths infection. Let me understand the meaning of Helminths. Helminths is the medical terminology. It means we can say worm. Worm means a small little type of, in Hindi we can say कीड़े, बच्चों के पेट में कीड़े पड़ जाना. So it's a worm infection. So Helminths means the one infection by the in unsanitary or the unhygienic condition, contaminated food or contaminated water, or maybe because of the pica. This type of helminths infection, chances of occurring the helminths infection because of such a reasons. So here etiology means what is the causes of helminths infection. The first cause is roundworm. Roundworm means there is a worm. It's shape it's all depend on the shape, so it's a round shape worm. So because of the round shape worm, the chances of helminths infection. So roundworm. Then pinworm means the shape of that worm is pin shape like a just needle shape. Then here after the pinworm, hookworm means the shape of the worm is hook like a single finger and hook. This hook just to stick anything, it's a hook like structure. Then the thread means simply a thread like shape. Then the whip. Now here whip means starting and ending point is narrow and the inner means central line is wide. So suppose here, so starting line is narrow and end line should be narrow and the inner it's a thick, so it's called hook or whipworm. Like this, like a moon, starting and ending point is narrow and the center line is wide. So because of the whipworm, the chances of helminths infection. Then the mode of transmission is how it's transmitted from the one person to another person. The first region is fecal-oral. Now in the past means before some time it's there is no toilet in the village area, so mostly people used to go in the field, so there is a chances of having such a type of infection. So transmission, the first one is contaminated food. So because of the contaminated food, the food is not properly means maintaining hygiene time of making the food or after the making the food, not covering the food. So this type of contaminated food can cause the helminths infection. Then the contaminated water. Then pica is the psychiatric condition in which a baby or a person, mostly a child, started to eat unnutritional substance like cement or cloud or what is it, mitti we can say that. Then chalk, whatever the chalk is there, pencil or the paper or the cloth, they are just chewing. So because of that there is chances to having the helminths infection. So pica is the condition. So after the mode of transmission, let me understand about the predisposing factor. Means what is the factors which are affect the helminths infection. The first one is unsanitary. So because of the means unhygienic, we can say the unsanitary means no sanitization is not properly, the food is contaminated, the water is contaminated or anything is contaminated and baby is starting eating, so it's the chances of having the helminths infection. Then the malnutrition, suppose baby is already malnutrition, he is hungry and he will just chewing his nails or the cloth or anything, just whatever coming in his hand, it is just started to chewing, so chances of having the helminths infection. Then the improper cooked food, so the food is not cooked properly, means raw food is containing, and because of this chances of having the helminths infection. Then the last one is improper hygiene, as I already said here in sanitary, that's improper hygiene means not washing the hand before eating anything and the contaminated whatever the either germs and bacteria is eating and chances of having the helminths infection. So after the predisposing factor, we will understand the clinical manifestation means sign and symptom of helminths infection. The first one is weak. A baby is looking very weak because of the malnutrition, because of the helminths infection, because of that is chances of having the abdominal pain, chances to having vomiting, chances to having diarrhea, laziness, and not focusing on anything, having the irritability every time because of the Helminths infection in the stomach, and because of such a reason there is chances to having pain also. Pain means not only the abdominal pain, baby will suffer from the hand pain, head pain, leg pain, means any pain, shoulder pain or the back pain. So these are the clinical manifestation of the Helminths infection. Now the diagnostic evaluation means how we can recognize that he is suffering from Helminth infection. First one is HC. HC means history collection, means nurse have to ask about the history collection, means asks parents about their baby's timing of eating, what he is eating nowadays, and any nutritional abnormality. So because of the history collection, our nurse can find easily. Then the PE means physical examination. Physically baby will look malnutrited, weak, lethargy. So because of the physical examination, the CBC means complete blood count. So in the blood there is a chances to having the rising WBC. So because of that, anyone can, means a nurse can find the Helminth infection. Then the X-ray and USG. X-ray having the abdominal X-ray also. Then USG means ultrasonography of liver or any stomach condition or any small or large intestine. Then the treatment means anti-helminthic. So a doctor will prescribe anti-helminthic because it's the Helminths infection. So anti-helminthic is the main treatment of this, and means apart from this we can also suggest the parents about the hygiene and the proper maintaining of sanitization of anything, about the food, nutrition, and the malnutrition. Just educate the parents to keep everything neat and clean. Then these are the treatment. So hope you getting understand this video. If you want to suggest me which kind of improvement you want in me, just comment me. And thank you for watching this video till here. So see you in next video. Jai Hind. Rise and shine.